Welcome back, everyone. We are in the third and the final hour of today's show, and I'm joined with an incredible collective of people who are going to be educating all of us on some incredibly important topics that we should all be knowing about. And I think this is just the perfect environment to really dig deep and understand these things that we all need to know about, regardless of your age, where you come from, everything. I would love to introduce the people I have in my room with me right now. Please feel free to go in whatever order and introduce yourselves and what you do and how you can help everyone.
Thank you, Sienna. So my name is Omosogi Muswaya. I'm a respiratory clinical lead in Northwest London. I cover respiratory service that does oxygen, supported discharge, post-COVID, COPD, complex management, and pulmonary rehabilitation. I have over 2 decades of nursing experience, having worked in the acute house in ITU, and then coming into the community, working in various community disciplines, all the way into where I am now working in the respiratory service. Thank you for having me today.
Amazing. That is such a lengthy, lengthy description. Such a hero. Thank you.
So, hi everyone. Thank you for inviting me and us to this show. My name is Letizia Mori. I'm one of the respiratory consultants working in Northwest London.
Beautiful.
I'll be short.
Hi there. Hello, everyone. Good evening. My name is Natalie. I'm a physiotherapist by background, but I've specialised in breathing problems and lung health. I've worked in adult services throughout my profession so far, in acute hospitals, in outpatient settings, in clinics, and I'm now, in the last few years, I've been working in the community respiratory services. So seeing patients with lung problems, mostly with COPD, in the hospital, in clinics and in their own homes.
Thank you so much. And I'm also joined with Harry as well. Oh, sorry. Harry, I think your mic is off.
Right, start again. Hello, can you hear me now?
Yes, perfect. Thank you, Harry.
Okay. Hi, I am Harry, 75 years old male, originally from Egypt. I have been smoker. Let me say that I'm semi-retired company director as an accountant, and I have been smoking for a very long time, excessively, but fortunately, I gave up about 40 years ago.
Amazing. Thank you so much. And we're actually going to start with Harry and talk about his experience with COPD whilst we allow him to tell us his story and his experiences and then give leeway for everyone else to kind of jump in and see how their part is played within this. So
Okay,
please go ahead, Harry.
okay. I had bronchitis, a very severe bronchitis, about 10 years ago. And I was diagnosed in Northwick Park Hospital as a COPD patient. And ever since, I've been through the journey of lots of inhalers. And eventually, I went to the Brent Respiratory Rehab Center with the help of Natalie. I am now on the right track, as they always say. Unfortunately, when I was young, was subjected to all kind of trendy ideas of smoking is very nice, very sexy, very interesting. And I was also working in a very stressful job, so really I was a very, very heavy smoker. But fortunately, I managed to get rid of the habit. Uh, One day I was fasting in Ramadan, and the first thing I had was cigarettes, and I felt dizzy and felt that the room is turning around, and I couldn't control myself. I fall on the floor, and that
Wow.
was an experience which made me give up straight away. I threw the packet of cigarettes and I never got back. I changed my clothes, changed my friends, I threw everything just to cut any relation with the smoking, and even change my friends because all my friends were very heavy smokers. So I said, okay, if you come to visit me, you should change your clothes and you come clean. And eventually I get rid of most of those smokers. And when I had COVID, it was very difficult situation for me because COVID would affect me so badly. And I never recovered from the effect of COVID, a combination of COVID and the COPD. And last year, I had a very acute bronchitis with, producing a lot of phlegm from my lung, and coughing was constant that I couldn't sleep at night. But thank God I managed to recover with the help of lots of expertise, like, my friend Natalie. She showed me how to handle my situation, my coughing, my inhaler wasn't having the inhaler the proper way. And I believe I'm on the mend now. I'm trying to do as much as I can. Um, that's a summary of what I have so far.
Well, it's amazing. It's an amazing story, and I think it's definitely one that I'm sure can relate to a lot of people as well, which is why I think it's so important to have these conversations.
Yeah.
And was it a thing where when you had the bronchitis, did you know that it was going to be as bad as it was? Were you kind of aware of these lung issues that you could have got beforehand? And do you think that maybe that would have swayed your brain a little bit into maybe not taking up smoking in the first place?
When I had the bronchitis, I was really very exhausted, work-wise, very stressful. And I believe that COVID didn't help much, really. COVID
Yeah,
made it more complicated for somebody like me who's, old, and the immunity system is not working as such. So probably this kind of combination recently, which make me wonder that I wish I didn't smoke at all. But
right.
unfortunately, you can't change the past. You can't change the friends you associated with. You cannot change the stressful work you had in the past. But my advice for everybody now, just don't do it. Simple, don't do it, because once you had the damage in your lung, the recovery is a damaged tissue. You cannot have the full functionalities of your lung anymore, and then the deterioration will be very fast, very fast. And all this new trend of shisha and vibes, and it's just gimmick. Once people get hooked on it, they won't realize until 30, 40 years later on that the damage is very slow but lasts. But
Ab-
lasts.
Absolutely. Absolutely. And I think you really did nail that to a T. And do you think, have you had a lot of obviously a COVID affects you really badly. What is it? How has it kind of changed your everyday life and kind of how are you dealing with that now?
I'll give you an example. I used to walk when I was about 32 years old. I used to walk from St. John's Wood to the West End and back. Now I couldn't walk from my home to the bus stop. I live on top of a hill and it's really a struggle. I have to stop twice and have my inhaler. This is show how the damage is, very severe. So whoever listen to this broadcast now, don't do it. And if you see anybody smoking, advise, tell them, don't do it. You have to pick up more nice habits and, spend better time with your family, with your friends than just smoking. And I am from a community, if somebody wants to be generous with you, he will offer you smoke, cigarette after cigarette after cigarette, and to show how affectionate and how, generous to you. And if you offer him back a cigarette, say, no, 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 it's on me. So you end up smoking your own and you passively smoke, inhale the others sitting around you smoking. So it will be an incredible dose of smoke inside your lung.
Yeah, I think you can definitely see how that can be a vicious cycle of
Very.
and especially like you were saying you had to quite literally cut people out to stop you from smoking.
Yes, I
And
throw my clothes and change my address, throw everything in my flat. And my friends, I said, well, if you carry on smoking, don't come and visit me.
wow, incredible.
Yeah.
Thank you so much. I just wanted to give the listeners another point of if they've just jumped in at any point, and also give an introduction. I think the first part of the recording did actually cut out, so I just wanted to give you guys another minute to let people know who we are talking to as well. So we just had the incredible Harry who was talking about his story as well and how he's been dealing with COPD and how he is absolutely encouraging people to not smoke and the damage that it really does do. Please introduce yourselves.
Yeah. So my name is Letizia Mori, and I'm one of the respiratory consultants working in Northwest London.
Thank you so much.
Mm-hmm.
Hi there, my name is Natalie. I'm a respiratory physiotherapist working in the community with people that have lung conditions.
Amazing, thank you.
Hello, my name is Sergey Omosogi Biswaya. I'm a respiratory clinical lead who works in Brent. I work with patients who have COPD, but in addition to that, we look after patients who require oxygen, who require supported discharge from hospital, who require complex COPD management, pulmonary rehabilitation, and also post-COVID service.
Amazing, thank you so much. And I actually wanted to start off the questions and ask you, what is COPD for the people listening?
So COPD is a chronic inflammation of your airways. It has many causes, and I'll talk briefly about that. But mainly, as Harry has said, is caused by smoking, and it results in an obstruction of your bronchi that makes it difficult for you to breathe. As I said, the exposure to many other irritants can cause symptoms like the smoking symptoms in COPD, but also other conditions like genetics and familiarity, or long-term asthma that chronicizes in time can lead to a COPD picture, let's say. And in COPD means chronic obstructive pulmonary disease. is an acronym, as simple as that. But inside COPD, there are different conditions, mainly the chronic bronchitis that Harry has been describing very well, but also emphysema that is not really affecting the airways, but more the alveoli by distracting the alveolar space.
Amazing. And that's once again something that I think a lot of people aren't familiar with, which is why it's so good to talk about this. And how do you know if you have got COPD? I think this is definitely a question that I ask myself because I'm a hypochondriac and I'm Googling everything, even if I have a cold, I'm always thinking I've got the worst things. So it'd be incredible to know what are the actual symptoms and the early signs, and how can I kind of, yeah, know that I have got COPD.
So that's a very good question, because symptoms can start very slowly in time and they can be quite subtle. I would say one of the first things that you might notice is that you start to be a bit more short of breath on exertion. But also you start to have a bit of a persistent cough, especially early in the morning with some phlegm coming up. You can have a feeling of chest tightness that, of course, has many degrees. It can start like a bit of a discomfort and become more important during the years. Another thing that needs particular attention is the amount of chest infection that you get through the year or in the first few years, when this is starting to become a bit more often than usual, which will be almost nothing, is COPD is something that you should be starting to think of. Also, persistent fatigue, feeling exhausted at the end of the day without having done much or anything much different from usual before. And of course, I mean, all of these associated with an habit of smoking, not only tobacco, but also cannabis or other habits like that, can make you start thinking about, stop, maybe I need to be checked and I need to know if I have COPD.
Incredible. And what kind of time frame would people be looking at? Because I know you had mentioned if there's like a repeat of chest infections, when is probably a bit of like a good indication and a warning sign when somebody should probably get this checked?
Well, any people is different, right? So there might be also other conditions that can be present at the same time and increase the frequency. I would say that obviously a normal person, healthy with no other problem, shouldn't get any chest infection. But if you get 2 chest infection in 6 months in a winter season, you should be starting to worry.
Right.
Get checked.
Amazing. And if, say, somebody was an avid smoker and if they had, say, chosen to give up, or would this still be, would it just go away straight away, or is there still kind of like a process in trying to, get medication to get it to go?
So unfortunately, COPD is a chronic disease, and once you have it, you cannot reverse it. What you can do by stop smoking at the first symptoms or a diagnosis of COPD is stop the progression or slow down significantly the progression of your COPD. And that means being able to manage your symptoms a lot better. If you continue to smoke after a diagnosis of COPD, you will be increasingly more short of breath in short time. You will be increasingly hospitalized more often for important chest infections, and everything will progress much quicker.
Right.
You'll have a good quality of life, but you need to understand that giving up smoking or taking away whatever is causing it is the main action that you have to take.
Absolutely. So basically, just don't ever start. And if you have started, the sooner you stop is always going to be the better process.
The sooner.
Amazing.
So
And
yeah.
carry on.
I'm just saying, if you're a smoker, if you think that you can have more of these symptoms and you start to get worried, the first thing that you have to do is just reach out for your GP and speak about what's happening into your life. Be honest about your smoking habits and all the other lifestyle habits that you have. And GP usually have access to the right test to be diagnosed with COPD rapidly. And if not, they can refer to secondary service for that. The main, let's say the gold standard, the main exam to reach a diagnosis is spirometry. It's very simple. It can be done in GP practices or in several hubs in the community. So it's now very easy, let's say, to access this kind of diagnosis.
Perfect. And I think there's definitely a sense of always just to get it checked sooner rather than later, always. And what is the treatment process when that diagnosis has been made?
So when you have a spirometry, not only we can diagnose you with the disease, but also we can have an idea of the severity of your disease. And depending on that, there are different treatment approaches. In first instance, you'll be prescribed with some inhalers that have the aim to keep your bronchi uninflamed and at the same time to try and open them up as much as possible. They're called relievers sometimes, the blue inhalers that everybody knows about, I guess. But then there are many other kind of inhalers with many combination of drugs inside that can help with that. During exacerbations, so during chest infection, you are likely to be prescribed with antibiotics. But if your oxygen levels tend to drop in these episodes, then you would likely also to be prescribed with steroids. And but this is only for a short period of time. And in the very long term, of course, if the disease progresses and you haven't done the lifestyle changes that we were talking about, there might be the need of starting on oxygen treatment.
Amazing. That's incredible information. You are just nailing these questions. And obviously, I feel like a lot of people would say, and it'll probably be the first thing on their minds, is if the damage is already done, what is the point in stopping smoking? And I think some people do really get that in their head where they're like, well, if I've already done the worst of it, then why should I stop? Why is this such an important message to not let that mind frame get in your heads?
No, because it will get worse if you don't stop. That's as easy as that. And at the end of the game, if you don't stop, it might shorten significantly the length of your life and the quality of life.
And Harry, obviously you spoke about how this has affected you. What would you kind of say to someone who may say that to you after you've experienced what you have with COPD?
Well, I would say start counting the time for death because
Wow.
it is very serious. If you cannot breathe, then you die. As simple as that. People have, whoever will put this idea forward saying, well, what's happening? The damage is done and carry on, okay, carry on. But with you carry on, start counting the minute and the second towards your grave. If you want to do this, well, fine. We live in a free society. You want to kill yourself, it's up to you. But I wish that nobody would do this. You would think logically that you have a family, you have people around you, they need you, they need your support. So if you and you need you fit and capable to support them, and to, if you have children, to enjoy the children and see them grow in front of you. So the attitude has to be what you're looking for, you know, what is your perspective of this? You want to die, nobody will stop you. But, you know, think of the people around you. Think about, you know, your family, your friends, and they all part of you. You are not uh, live alone. And then think about the quality of life. Spend the money on a holiday, spend the money or present or gift to your friends, your family, and instead of making the fat, ugly capitalist producer of smokes and cigarettes get richer and richer. And unfortunately, nowadays they invent this new idea of the vibes and the shisha, and you say, oh, it's just to take the shisha once a day, but you have a huge amount of damage in one go, and then you become addicted. And the clever cigarette manufacturer, now they're moving to the third world, and they start sending, because the restriction of smoking in this country and in Europe in general, it become more affecting them and their profits. So they move to the developing world, all over Africa, Asia. And you see people smoking so heavily. As I see sometimes when I go to my country of origin, people smoking incredibly in the street, in the bus, in the underground, in the restaurant. And if you say, please, can you, I said, well, I am free. I can do whatever I want. And we're gonna go into a different, but anyway, it's another topic.
Yeah. I think what we want people to know, and thank you, Harry, for that, because you summed it up, that a lot of people continue to smoke. But I think what happens with people is there is a stigma around smoking. As you mentioned, Harry, they've stopped smoking around, stopped smoking everywhere, in homes and in your office spaces. You're not allowed to smoke anymore here in England, and they've stopped smoking in public places. And with that comes with people feeling stigmatized, and they feel that, ashamed that they smoke. And they find it very difficult to get help because they put that barrier up that they're, where they feel isolated with their smoking habit. And what I want people to know is that they're not alone. We're here to help them get through it. I think the first thing I want is for people not to feel ashamed and to admit that they smoke, right? But to also know that as us as clinicians, we're aware that quitting smoking is hard. And we don't judge you for smoking. In fact, what we want to do is offer you some help, offer you help in a way that respects your journey to stopping smoking. And our role as clinicians is to support you in this journey. We're here to listen to what makes you smoke. What are the barriers that are stopping you from smoking? How can we then help you? And as mentioned earlier by Letizia and as yourself, Harry, is that early detection of COPD is really important. So the first signs you get of breathlessness, just because you smoke doesn't mean it should stop you from seeking help. Because by putting yourself forward and coming forward to your GP and letting them know that you're struggling with smoking, we can then help you. There are lots of medication out there now to help you with smoking cessation, which is stopping smoking. There are a lot of adjuncts we can help you with to stop smoking. So I think it's very important that within our communities, we don't think of breathlessness as just getting old and that is due to us working hard. But actually, we need to know that these are actually symptoms of a lung condition that is actually going to be life-limiting if we don't take action early on it. And it's very important that people don't fear to come forward for diagnosis, that they're seeking help whenever they can. And this will help them to take better control of their lives. I think my colleague Natalie will talk to you a bit more about what lifestyle changes people can make and what self-management plans they can put in place to support them. But what I want us to do is try and get rid of the barrier that stops us from smoking, that stops us from coming forward with our smoking habits. And know that even if you do smoke, do still come forward and we can still help you through that. And it's a journey, and everyone's journey is individual. Harry has mentioned his journey. It took him 40 years before he found out before he realized that actually the smoking he did 40 years ago was now affecting his health. So that just shows you how subtle it is and how insidious smoking can be over a length of time. But seeking help, as Harry has shown you, can actually help you get better, feel better, and take better management over your symptoms. I'll let my colleague Natalie speak to you a bit more about the lifestyle changes that are really important beyond just stopping smoking, that will really help your condition and help you manage your symptoms more effectively. So over to you, Natalie.
Thank you, Sogi. Thank you, Harry. I'd just like to start by just touching on one of the things Harry said at the beginning, was that he was a heavy smoker, and he was busy and he was stressed and working hard, and then he had bronchitis, and then he went into hospital. And this is quite a common story for people, is that they actually only maybe had some very subtle symptoms of a little bit of breathlessness, a little bit of cough, but then they had one quite severe chest infection that led to either an admission or to a trial of an inhaler that led them to their diagnosis. And that is, again, just another way to hit home that if you have subtle signs of breathlessness or cough, or people notice the sound of your breathing is a bit noisy compared to theirs when you walk, these little signs, to seek some support from your general practitioner and get an assessment. So moving away from stopping smoking, because we've gone there, but just in terms of the impact that the symptoms have on lifestyle and what you can do to help manage them. There's lots you can do once you have the diagnosis. So again, when you have the diagnosis, it's not the end for you. There's lots you can do when you understand the condition that you have. So most of that management that you can do and that you are supported with through respiratory services is what we call self-management. So that's one, is having an action plan for your symptoms and how to spot small signs that there may be a chest infection coming, or things that you can recognize to alert yourself to seeking extra treatment that you might need. The symptoms of breathlessness in particular are very impactful in your day-to-day life. Okay, so all of these symptoms can affect you from the moment that you wake, or more so in your sleep. As Harry said, his sleep was disturbed significantly by cough and mucus at nighttime, and the nature of the condition that Dr. Mori explained, with the swelling in the airways and the narrowing. You wake up in the morning and you don't feel great, you don't feel good, you have a heavy chest, a tight chest, possibly that feeling that there's secretion stuck on your chest, and your breathing is most likely worse in the morning. So getting going can be very, very difficult. And it's understanding what's happening there within your lungs, and knowing that your medicines, your inhaler therapy at that time is really important to take well. And so learning how to take your medicines accurately is something that we can help with. And how to manage excess sputum and phlegm that gets in the way of your breathing as well is a big aspect to that. And for me as a physio, I would say the most important is keeping active. It's one of the biggest things that I would like to hit home today. The symptom of breathlessness is very frightening, and it's brought about by exertion. So when you're moving your body, particularly your arms above your head, things like that, or whole body movements, or walking uphill, as Harry said, you have this experience of breathlessness. And it's only when you've had it and it doesn't go away that you can truly understand the symptoms that people with COPD feel, and the fear that it can put on you as well. So often what tends to happen is that we avoid the activities that make us breathless, and that deconditioning and reduced fitness that happens as a result will actually make our symptoms worse. So it's understanding the condition, and that some of your symptoms like breathlessness aren't harmful to you, and you need help to get desensitized to those and get the confidence to get as fit as you can be with COPD. Get information around diet and eating healthily to boost your immune system and build muscle to help support your oxygenation and your breathing muscles. So there's lots and lots and lots of things you can do with lifestyle changes, but with support and giving you confidence to exercise safely and push yourself, because you can get fitness and get fitter and get healthier even with a diagnosis of COPD. It's really important to know that you can make yourself feel significantly better even if you have the diagnosis, even if you continue to still smoke. So it's not all of these treatment options and self-management plans are available to you if you still smoke. The benefit, however, will be smaller. And it's something that you need to think about. The risk of further chest infections is something that's really important with COPD, and preventing them from causing lasting severe or progressing your condition on. So I might leave that to put that back to Sobi to talk about that in a bit more detail.
Yes. So I think it's really important that you seek early treatment, as we mentioned earlier. And like Natalie mentioned, the lifestyle changes are really important. So in terms of managing your COPD, what we say is stay active. Whether your breathlessness is not, keep active, because as Natalie said, activity does help to strengthen your respiratory muscles as well. And then it actually reduces that symptomatic breathlessness you're feeling. We also provide something called pulmonary rehabilitation, which is a specialist class that we run that provides individualized exercises for people who turn up with COPD. Now, we can see you quite early on in your condition before you've even hit hospital or needed to start on antibiotics. So as soon as you're diagnosed with COPD, you're affected by breathlessness, see your GP and ask them for a referral into pulmonary rehabilitation. Most patients actually end up qualifying to attend pulmonary rehabilitation. As we say, stopping smoking is the mainstay, it's really important, but we also have medication that we give you. So most of the therapy we give you for managing your COPD will lie in the realms of having inhaled therapy. So it's very important that you learn what your inhalers are and take them as they're prescribed. And always speak to your clinicians if you're unsure, because what we found is if you don't take your inhalers effectively, you're not getting the drugs deposited into the part of the lungs where you want it to go. And then also learning how to pace yourself. I think Natalie mentioned this, that you still need to keep active, but there's a way of keeping active. You pace yourself. As Harry mentioned, he's got a hill at home that he needs to walk up and down. He stops halfway, so he's already gauged how far he can go push himself, but he still continues with the exercise. But what he knows now is how to pace himself. So very important that you pace yourself through the exercise. And then also, I think, is to listen to each other. Listen to your family. Your family are the first people who notice subtle changes in you. And they're the first people who will tell you to go and seek help. So in terms of our pathways in brain that are available to you, is when you feel subtle changes, breathlessness, and you think it's a cause of concern, you've had a long smoking history, go see your GP. That's the first thing you do. And then once you've seen your GP, mention to them that you've heard about something called COPD. Do you think I might have it? And then ask them, I think patients, we need to advocate for ourselves now and actually come forward and say what we need for our own health. And that's why we have platforms like this to discuss COPD and promote awareness of it. So seek that help from your GP. Let them know what you think is wrong. Because I'll tell you this, patients know what's wrong with them. People actually know more about their health than the practitioner does. I think Letizia and Natalie will agree with me that Harry knows more about his health than we do. What we're here to do is to support him in making the right decisions on how to manage his health. So that's very important too. They'll send you off to have a spirometry, like Letizia mentioned earlier. It's a simple test that can be carried out in your GP surgery, community clinics, and that's the first test that gives you the diagnosis for you to get access to services like ours. So really important to get diagnosed quite early on. And, I think Harry's experience has just covered it all for us. It's let us know the importance of getting the right diagnosis at the right time, understanding what your condition is, and then now knowing how to manage it. As Natalie has mentioned, these lifestyle changes are very, very important to prolong your life. Dr. Mori mentioned to you earlier that, you have a chronic condition. It's a lasting condition. However, you can still live well and breathe better with your condition with the help of some of the services that we have available to you. And, seek help from everyone here on this platform. We're here to support you. And as your condition progresses, there will be more support available to you. And Natalie works really well around self-management plans and also in pulmonary rehabilitation class. And that's one of the biggest things I'd like to promote today, is that attend exercise classes like pulmonary rehab if you can. get yourself diagnosed and get out there and seek the help you deserve. And don't stay at home. I think in communities, and we're focusing today on the BME communities, and what is one of the barriers with BME communities, we feel that we shouldn't get help. We feel content. We know that we smoke, and we feel that because we smoke, the consequences of smoking are ours to burden. And so we shouldn't actually go and seek help because of it. We feel that we're getting old, that's why we smoke. We smoked and now we're getting old, so we should be breathless, we should cough. You know, we worked really hard and now we're breathless. And so we kind of accept these symptoms as being the norm for our lives, but they aren't normal. And you should actually be going to seek help at that point. And please don't think that someone else deserves care better, more. Someone else deserves care before yourself. You should get care for yourself so you can care for others. So make sure you're going to get help for yourself and look after yourself. Thank you.
I think amazing. And I think going on with what you said when you were talking about support, maybe Natalie, I think maybe this is more your way. If you have a family member who's been diagnosed with COPD, what is the best way to also support them? Obviously, we know that trying to get them to exercise or walks are also good, but is there any other, support that somebody can give a family member or a friend or a partner or anyone?
Yeah, it's a really important question. I think there's a few different ways to answer that question. I think the first thing is to help your loved one get informed about their condition. So attend appointments with them, support them in attending appointments. Secondly, again, along the lines of supporting your loved one to keep active, because often when we see a loved one that's of an age and that's getting breathless, we may have that an instinctive reaction to do things for that loved one. Yeah, to let me do that for you, let me do your shopping, let me do this, when actually what you want to do is help support them keep as active as they possibly can. If you have a smoker in the household, it's quite common that you'll probably have more that you smoke yourself as a loved one. So helping that person to stop, the best thing you can do is support them and do it with them. And or at least make the environment that they're living in have clean air in it and not smoke inside. That's one of the biggest ones, because often that person may attempt to quit, but if they've got loved ones they don't want to send away, they may put up with passive smoke within the house. It's quite easy to isolate yourself when you get breathless because you don't like the idea of, or when you think about planning an event or taking a trip or traveling and things like that, or seeing family, particularly with breathlessness, the idea of getting up, getting dressed when you're not feeling well, using public transport, getting somewhere, for example, can be quite overwhelming. And often people decide, no, I'm not going to do that. I'm too sick. So again, enabling your loved one in order to stay connected with their communities, to stay connected with family. It's really important to keep your mood up and to keep mobile and to keep active. Additional things, other than big lifestyle changes, would be vaccinations and promoting those, because that's another form of protection. Because as Harry said, when you have a lung condition, you're much more vulnerable to getting a chest infection, and also the damage that those chest infections can do are quite long lasting or can be permanent. So where possible, if you're not vaccinated yourself, vaccinate yourself to reduce the risk of infecting your loved one, and also maybe discuss vaccinations with your loved one as a form of protection. Other lifestyle support is nutrition is super important. And so bearing in mind, talk to your loved one about their symptoms and how it feels, and what they want to do, what they want to get out of days, because sometimes you really do have to conserve your energy. And so the idea of a trip out to the shop, for example, was a great idea, but that person may be thinking, oh, it's going to take 3 hours, I'm going to be exhausted by the end of it, and I'm not going to have enough energy. So talk to your loved one about what they want to do that week, what they want to do that day. Help them get their enjoyment out of the tasks they want to do from day to day. And supporting them, helping them eat healthily is really important. And again, eating when you're breathless, keeping adequately nourished can be quite difficult. Breathing, eating, and just the act of chewing can be difficult when you're severely breathless. So we advise that you encourage people to eat little and often, as opposed to, again, instinctually, let me cook you a meal and put a big food, your favorite plate in front of you, for when someone who's breathless may find that overwhelming and not want to actually touch it at all. So just think about talk to your loved one about their symptoms and what their priorities are and goals are for the next month, for the next week, for the next 6 months, and support them in keeping as active as possible. That's what I would say. And there are associations out there like Asthma and Lung UK. They're excellent. They have wealth of information on there around all of those self-management tips, as well as exercise videos, support for carers, things like that. So I definitely would recommend having a look there if you've got a loved one with COPD.
Incredible. Thank you so much. And as a kind of wrap up for anyone who's just joined in, we are talking about COPD and the importance and the relevance of knowing what it is, knowing the actions to take on it, as well as the support. And I'm joined with an incredible collective of people, and I would love for you guys to let people know ways to contact you, your roles in this, and any lasting feedback you would kind of like to finish this talk with, and kind of have some points that you really want to stick with the listeners.
I think what I want the listeners to know that is around smoking, I really want us to break down those barriers. And I want to share a patient story with you of a patient who had challenges with smoking and who came to see us. And they came through all three practitioners on this call today. And this patient had severe challenges in and out of hospital several times. They were a smoker. The condition was so severe that they ended up being on oxygen, requiring oxygen support.
Wow.
But they still remained active. They still attended pulmonary rehabilitation classes to keep active. They still wanted to quit smoking, but every time they tried to embark on a quit attempt, they persevered for about a week or so, and then they failed. And in the end, the things that we do as practitioners is find out, like I said, what are the barriers for you as an individual? So we went through the patient's history and found out that actually they were suffering from bereavement. A bereavement that happened years ago, but they hadn't grieved enough and they hadn't received any grieving support. And so once we knew and found out what the issue was, we were able to give them the right support in order to help them and support them in their quit attempt. And over time, they managed to stop smoking. And this time around, when they actually managed to stop smoking, we're giving them all the medication that can help you stop smoking, because there's a lot of medication we can give you, in addition to nicotine patches. We do inhalators that are available for patients to try out, but also we've got medication that can be prescribed for patients to help them stop smoking. What that medication does, it makes them get a sensation that makes them not want to smoke. Right, it makes them feel a bit unwell when they come across, the smell of smoke. So that's also very important for patients, so that they are the things they can use. And this patient ended up stopping smoking without any of the adjuncts once we found out what the source of their anxiety and stress was and what was making them relapse each time. So when you're quitting, you don't try and quit once, you quit over and over again. It's about perseverance. So what I'd love our listeners to know today is you can persevere. It can take time, but once you seek help early on, it means that you can take better control of your life and live a longer, healthier, active life from doing so. Now, when you stop smoking, I think you mentioned earlier on what people feel like when they stop smoking. They start coughing and they feel really unwell after they stop smoking. And they think that, why should I bother stopping smoking when I have all these symptoms? I feel worse. But actually, those are your lungs getting rid of the toxins. So our bodies are incredible organs. They have lots of incredible organs. It's actually filtering out all of that gunk that you've had. Now, I always think of a brush, a broom. If you use a broom on the floor and you're brushing the floor all the time, the bristles on the broom harden and they collect with dust. And that's similar to our airways. When we're smoking, our smoking is actually clogging our airways and making it very difficult for the lining in our airways called cilia to beat and expel all of the toxins. They do it all the time, but they slow down like a brush, like a broom. But when you wash that broom and you shake it off, the bristles come alive again. And that's the same thing that's happening in our lungs. When we're coughing and expectorating lots of phlegm when we've just stopped smoking, that's our lungs getting rid of all of those toxins that are in our lungs. And then after a while, you give it a few months, I think about 3 months on average, you start feeling a lot better. Good color comes back to your skin. You start feeling back to your normal self, and even better at times. And your breathing gets better. And all the other elements you had before seem to just disappear. So look after your health. It's never too late to start, and just keep persevering. And we're here to help you through that journey. If you want to get hold of us, the first port of call to come to our service, because we're a very specialist service. And so to get hold of us, definitely start with your GP surgery, start with your healthcare practitioner. If you've seen another practitioner who's coming to see you for other conditions, speak to them to begin with and ask them for a referral into the respiratory service in Brent. And we'll take care of the rest. Because once you come into, I think Harry can tell you this, once you come into our service, we don't let you go. You're stuck with us for a while. So we keep hold of you and we support you throughout your journey. So even when you're discharged from our service, like Harry is at the moment, he's got a number to call him directly. He doesn't need to go through his GP to come into our service now. He can call us up directly and access the care services that we can provide. And we can look after your journey from when you start to when you start feeling better. And we continue to support you with all the lifestyle changes, the self-management plans. And so, yeah, I think that's the first port of call. Speak to your general practitioner. And please don't hesitate to go and see your GP. I know it's a long way to see GPs. I know patients put all these barriers up about accessing GP, but it's worth it, okay? Putting that call to your GP, go there with the facts, say, I think I have breathless symptoms. I think I've been coughing for a while. I think I've had a long smoking history. You know, I've been smoking for 10, 20 years. I need help. I think I may have this condition. It could be COPD. What do you think? And that's where you start. Start advocating yourselves and for your family and your community. And I think that's the way we need to go these days. You know, take charge of your life and live the best life you can, being as healthy as you can and as lung-free as you can. Now, for smoking support across the borough, we have lots of smoking support. There's a smoking cessation Brent, which you can access on the Smoke Cessation Brent website. They look after any patients who smoke due to shisha, pregnant women, and people with mental health. And Smoke in London support patients with any other lung conditions who still smoke and want support. So yeah, that's what you need to do to get hold of us.
Beautifully said. Thank you so much. And Natalie, and let's hear if you have anything else to add.
I think Sogi has said it all.
Yeah.
Perfectly.
Don't feel ashamed or judged because you smoke. I mean, lots of people, millions of people smoke everywhere. It's a common thing. We know how to help. Just reach out.
Amazing. Thank you so much, guys. I mean, even just for me, this was so informative. And I think just for every listener out there, whether you are young, whether you are older, or any person, basically, I think this is incredible information to know about. And I think this was such a clear example to show people what an incredible support network there is to help people who are suffering and to make the suffering a little less and even just manage it and be able to make some compromises within life. But I think exactly like you said, it's about putting ourselves first and making sure that we are spending the time to look after our health properly. And you know, if it's something that can be stopped, like it is with smoking, I know it's obviously easier said than done for so many people, but it is about, like you said, finding the roots of why this was started in the first place. And like what Harry was speaking about, if you are in a stressful job, find ways to maybe manage that stress and lower the intake. I think all of these small changes will make such a huge, huge difference. So thank you guys so much. And like they said before, go to the GP, don't hesitate. Incredible. Harry, do you have any last words for us?
Well, what I say that, I wish the best for everybody, and the quality of life is very important. Smoking doesn't give a trendy, nice, but look for the quality of life. quality of life without smoking.
Always more important.
Yeah.
Amazing. Well, thank you so much, guys. Like I said before, COPD is incredibly important. In tomorrow's show, we're also going to be listing the ways and speaking about this briefly again throughout the entire show. So if you have jumped in at any other point, we're going to be rerunning this information tomorrow on the show. So make sure you're keeping an ear out for all of that as well. But to round up today's show here at the Beat London, I've enjoyed every single part of this with an incredible collective of people. And I am done for my show today. Thank you guys for tuning in at any point. And yeah, like I said, tomorrow, 4 to 7 p.m., we're going to be speaking about this throughout the entire show. And once again, educate the people around you, help the people around you. Support is so incredibly important. But thank you guys so much.
Thank you for
Thank
having
you.
us.
Thank you.